the U.S. tops more than 2 million cases of the coronavirus, with some states still seeing more than 1,000 new infections a day. That is the news. So we're going to be talking about that over the next couple of hours here at CBSN. And what I want people to understand is that this grim milestone and this fight against COVID-19, where there are more than 2 million confirmed coronavirus cases across the country, that is very significant, and it's something that we've been talking about for quite some time here on this network, Anne-Marie, but there is now one Harvard health expert who predicts that the death toll could nearly double by September. Laura Podesta has that story.
At least 16 states have seen a rise in coronavirus cases in recent days, according to data compiled by CBS News. The hotspots include large sections of the Southeast, Midwest, and West Coast. Arizona, for one, is seeing more than 1,000 new cases per day, up from fewer than 400 a day when the governor ended his business closure and stay-at-home orders in mid-May.
I think the question is, did we reopen too soon? Is a valid one.
Dr. Frank Lavecchio is an emergency medicine doctor in the Phoenix area, and he says he's seeing a surge of severe COVID cases requiring intubation. Testing sites in North Texas are now opening up to people who were part of the large protests across the region. Dallas, Fort Worth, and Houston are all seeing increasing case numbers, according to public health officials.
This could be just a blip on the radar, but everybody's watching very intently.
Miami, Florida opened its beaches for the first time in 3 months. But Florida is yet another state where coronavirus continues to circulate uncontrolled. 1,300 new infections were just announced yesterday.
We're going to be coming into Florida, do a big one in Florida, big one in Texas.
President Trump announced he'll be resuming rallies ahead of the November election. The first one since states began closing down for the pandemic is planned for next Friday in Tulsa, Oklahoma. Laura Podesta, CBS News.
So for more on this, we want to bring in internal medicine specialist, Dr. Neeta Ogden. So, doctor, states, more and more states are reopening. They're in sort of various phases, many of them moving from their first phase to their second phase. We've all watched, these protests. And I, for one, am starting to sort of question what the rules are as we increasingly engage with one another. I'm getting invitations to barbecues and parties, and do you want to go down to the beach? And I am not sure exactly, how I'm supposed to be behaving at this time now. I think things have gotten really blurry. So as states start to reopen, what should we expect in the next couple of months, and how should we alter our behavior?
I think you raise a really good point. As these states reopen, we just don't have a central message coming from higher up to do, let's follow these 3 steps. I mean, we know what they are: the social distancing, wearing face masks, disinfecting, but how does that play out in real life as we reopen? And as you said, we go to barbecues and we start expanding our bubble, our quarantine bubble, as these restrictions are lifted. And there is so much information out there in the news. You can read blogs that talk about this, but it would be great if epidemiologists, infectious disease experts would really come out with almost a plan and a consensus that people could use on a very practical level. I think from what I've read in that vein, it sounds like as places continue to open up and you can expand your bubble in a way, you have to think about your own level of comfortability and examine what other people have been doing. If it's going to be other family members, how strictly are they observing safety measures? How safe do you feel in the environment? Will it be an indoor gathering or an outdoor gathering? So there are a lot of parameters to consider. We've been talking about states where the numbers are rising. In California, for example, there has been some data looking at where these rising cases are coming from. And in part, it's from families getting together again. One case in particular I read about is a family who crossed state lines and they had a gathering, and this led to infections. But then we're also seeing it in places we'd expect, like skilled nursing facilities, even in jails. In a state like Arizona, there's some criticism that yes, while they did observe quarantine early on, as the restrictions were lifted, the governor isn't wearing a mask, and people are sort of letting caution go to the wind, and they're not wearing face masks. They're not observing social distancing unless we really can, firmly create a message that Americans can follow, I think we're going to continue to see more of the same, unfortunately.
Yeah, doctor, we talked to a lot of protesters, for example, who were aware that COVID-19 had not left us, and yet they felt so strongly about police brutality, about the killing of George Floyd and Breonna Taylor and Tamir Rice and Eric Garner, and the list goes on, that they wanted to take their constitutional right to protest, and they did so. Many of them wore masks. You saw a lot of police officers, though, and members of the military not always wearing masks. Certainly, there is concern for those individuals. It's a very different story, as Anne-Marie was saying, for people that are suggesting going to barbecues or people that were complaining about not being able to go to the gym or having to wear a mask in a Walmart. But the reality is, as the evidence is pointing out, as bearing, that this is not yet gone, that we are in potentially for a rude awakening over the next couple of weeks. And now we're also hearing some disturbing news when it comes to patients who were on ventilators for a long period of time. Some of those individuals are taking days or even weeks to wake up from their medically induced comas. Why is that?
Yeah, I think this is a really grim reminder of how, I think that there is this misconception that we're, even among the protesters, that we're young and we may just get a cold. But the study that you're talking about, this information shows that people who have had severe coronavirus, that has been hospitalized and on ventilators for a long period of time, they've had prolonged recoveries. And we're seeing this is one of the sort of sequela of coronavirus that seems to exist on many different levels. In this case, typically what happens is when you're on a ventilator and they remove sedation, you start waking up immediately or within hours. In these patients, it can take days to weeks, which is baffling to physicians. They've almost described it as a coma-like state, eyes closed coma-like state for weeks. What it could be compared to is if you've been in deep sedation for a major surgery, and now you have that post-ventilator cognitive dysfunction. And the way it manifests itself is they describe it anywhere from memory fog and memory lapses to more significant cognitive and physical impairments, just not being able to express yourself or follow simple commands. And that may require more severe interventions like brain rehab. So it's kind of shocking. And we're not exactly sure why this happens in coronavirus patients. We know that coronavirus led to clotting. And so some people speculated this could be due to strokes or mini strokes. But in some of these patients, their MRIs were normal. So then perhaps it's due to brain inflammation from the coronavirus, or perhaps the coronavirus actually crosses the blood-brain barrier and causes direct injury to brain tissue. It's still unclear, but we do know that this is happening in real time, and physicians are quickly trying to gather information about these patients so we can act more quickly and figure out what's going on.
Really, really fascinating. Dr. Neeta Ogden, thank you. Grim reminder that we're not out of the woods yet when it comes to COVID-19. We appreciate it.
Oh, sure. Thank you so much for having me.